When you come for a diabetic foot check, we don't tell you whether you're diabetic or not. That is the responsibility of your GP or other healthcare professional. But once you have a diagnosis of diabetes, it is important to care for the health of your feet and have them checked regularly. We encourage all our patients to check their own feet on a daily basis. If you have difficulty reaching your feet or seeing the underside, then you can use a small mirror that you place on the floor, which will allow you to see the underside of your feet. When you come to see us, we like to see as much leg as possible, and we're looking for differences in colour, areas of redness, unexplained swelling. We look at hair patterns and look between the toes to see whether there is ulceration, minor abrasions, interdigital infections like an athlete's foot infection, anything which might cause a breach in the skin and lead to other problems. So these look great. What we're going to do is look for differences in sensation now, because one of the things that can happen to a diabetic is they can start to lose sensation in one or other parts of their feet. A simple test we use is using a 10-gram microfilament, and we use this to test for sensation by pressing it until it bends slightly and asking the person if they can tell us whether they can feel it. Once we've established whether there is or isn't neuropathy, we then check the pulses, and normally we'll only check two if we can find them: the dorsalis pedis, which is on the top of the foot, and the posterior tibialis, which is on the inside of the ankle. If we can't find a pulse, or we'd like a little more information, we can use a Doppler, a mini Doppler. The tests that are used in a diabetic foot assessment vary from practice to practice, and there's no standard set, so don't be concerned if you see something in one place that isn't performed somewhere else. We may use a reflex hammer to check the reflexes in your feet and lower legs. We may use a tuning fork to test for perception of vibration. We may also test for proprioceptive awareness, where we ask the person we're examining to close their eyes and we move their toe up and down and ask them if they can tell us whether we're moving the toe up or down. Once we've completed your diabetic foot check, we make a note of all of the results, and so when we see you next time, we have a benchmark against which to measure any changes. So we recommend a diabetic foot check at least once a year, and we recommend that you check your feet on a daily basis in the meantime and contact us at any time if you're concerned about any changes that you may have experienced. If you're newly diagnosed as a diabetic, or you'd like more general information on diabetes and your test and assessment results, we have a useful booklet which just explains in very simple terms what they all mean, and it's a good reference guide to have in the drawer. If you'd like a diabetic foot assessment, which can be performed as part of your treatment, then give us a call on 01628 77 3588.